Yemen's humanitarian crisis has reached a catastrophic low in 2026, with international aid funding dropping to record lows, pushing the country further into more suffering. This report has more.
The humanitarian crisis in Yemen has reached an alarming new low in 2026, with severe funding shortages accelerating the country's descent into a humanitarian disaster. Over 377,000 deaths have been reported since 2015, with 60% of those attributed to hunger, disease, and lack of medical care issues that have worsened as international aid contributions drop. In 2025, international funding dropped to just $680 million, only 28% of the required target, signaling a dangerous reversal of progress made over the last decade. This funding gap is exacerbating the country's existing political and economic collapse, trapping over 21 million people, two-thirds of Yemen's population, in a state of acute vulnerability. State policies, particularly from Western donors, have cut crucial aid, leaving the UN's humanitarian response plan underfunded by 75%. This has led to the closure of over 450 health facilities, disrupting vital services like maternal care and emergency treatments. Julian Harness, the UN humanitarian coordinator, warned that the situation is only expected to worsen as the country faces more widespread food insecurity, with malnutrition rates spiking, especially among children. These challenges are compounded by ongoing blockades, inflation, and factional violence, which have devastated Yemen's economy, pushing nearly 60% of the population into extreme poverty. In addition, thousands of jobs have been lost, and food imports continue to be obstructed, deepening the crisis. As violence continues to escalate, with over 2,500 political events documented in late 2025 alone, the humanitarian impact of the conflict is becoming more severe. Ongoing clashes between armed groups and the use of landmines have further delayed aid deliveries and increased civilian casualties. Meanwhile, aid workers are being dismissed, and women-led NGOs critical for local support are particularly affected. The collapse of Yemen's health infrastructure, including outbreaks of cholera, measles, and polio, has pushed resources even thinner. The worsening situation could easily lead to a full-scale famine if urgent action is not taken.